diabetes, there's a lot of people with pre-diabetes. There's a lot of people that are undiagnosed, and they may have diabetes. Generally, we have a very obese population.
Secondly, this is a very blue-collar area. So we don't really have a very educated population here. This whole thing goes with, the obesity, I think, is a lot more rampant, and then conveying people and making them understand the extent of and the nature of the disease that we are up against is very underestimated by our population here.
My old doctor used to tell me, you gotta watch your sugar, and I never paid attention. I didn't know what that meant.
They're blue-collar workers, so they work on their feet all day, so they don't want to come home, they don't want to exercise, they don't want to start cooking. It's easy to grab a burger, it's easy to stop by the local chain.
Because it boils down to money, I think, in a lot of cases. So if they have to choose $80 to pay to get their A1C tested, they're going to put it off. They're not going to.
The biggest lifestyle change is dealing with family. My husband, and there for a while my cousin. I was trying to share my new knowledge, and they were taking it that I'm Miss Know-It-All and telling them how they should be.
Well, I think the biggest challenge that I see is having the patient accept the fact that they have a lifelong disease state that they need to manage. So we're the helper to help them manage this.
And so when you're talking to Christine, did she help you with that process?
Yes, she did.
How did she help you?
I really took it all in, and she made me feel better. I was scared to death at first.
Past when I had these people that would come in with an A1C of 11, and then you start bringing them down, and they feel so much better. Like, I didn't know I felt bad before, but now I have energy. Now I don't just sit in my chair all day. So I think that's one of the biggest motivators. And then also coming in, saying every time we see them, oh my gosh, you look great, you lost a couple pounds, I can tell, just kind of keeping that motivation and positive energy up. We're doing $20 for all 4 classes.
Wow.
And patients say, there were other classes I saw, but they were $300. There was no way I could afford it, so my doctor told me about this. This is amazing. I'm telling my family I'm going to bring my mom next time.
We have not had any single person that had a negative feedback. Everybody's really positive about it. The feedback going back to the doctors is good too, so they're not just telling us maybe what they think we want to hear at the moment. Oh yeah, this is really good, and then leaving and saying, oh, I'm not doing that anymore. They're coming back. So.
Blood pressure's improved, that their triglycerides and their LDLs and all the things worked out. And we've done that. And we've done that multiple times, and that's great. Because at the end of the day, it's about the patient. However, if you cannot be paid and you cannot receive reimbursement for those services, you are always subject to the services ending when the grant ends.
Clinical services need to be the future. You can see it so clear when you start to do it. But we need to keep the product, and I don't want to ever be associated with every time the news comes on or somebody says, we see, the blue tray and the hand. I don't want to be that anymore. I don't think any of us want just to be that anymore. It is pharmacy, and everything has its place, so to speak, but I think we need to evolve more into the counseling. So then when they come in, the crew comes in to say, oh, we want to put this thing about pharmacy on the news. They say, oh, well, can you have the picture of the pharmacist, counseling somebody instead of the blue tray. I'm invested personally here because It's my daughter who's the next generation, and I want to see it continue, and I want to see it continue for generations after that, and for us just to keep evolving, and this is where it's at.